Welcome to Lagos Agencies in Focus. Today on Lagos Agencies in Focus platform, we're proud to present to you a special one-on-one interview with the Permanent Secretary of the Lagos State Health Management Agency, LASHMA, Dr. Mrs. Emanuela Zamba. It was quite expository, talking about the major policy initiatives, efforts, and achievements of LASHMA in recent times. Enjoy it. You're still watching the City of Lagos TV show on TV Nigeria. Welcome to another very interesting segment or package of the Lagos Agencies in Focus, designed and intended to promote, project, and of course celebrate the very unique success story, achievements in terms of policy formulation, programs, projects, efforts to deliver on the Things Plus agenda of Governor Babajide Sanwo-Olu. Today we are going to be looking at health management. And of course, in any society or city like Lagos, the government of the day has been able to come up with very strategic, creative efforts to deliver quality health services. It's not really all about delivering policies or making policies. It's about implementation of these policies. And very key is management. There is a strategic agency that is saddled with its responsibility, Lagos State Health Management Agency, LASHMA. Interestingly, we have the Permanent Secretary of the agency, talking about Dr. Zamba Olutoyin Emanuela. Madam, you're welcome. It's a pleasure to have you on the program.
Thank you.
Let's just start from the basics. And the basic is, what is the mandate, the vision and mission statement, and of course the core values of LASHMA? It's very important we start up with that basic question.
So essentially, LASHMA represents the state's commitment to achieving universal health coverage, largely through the vehicle of health insurance. So what the mandate of the agency is essentially is to ensure that all residents of Lagos State, regardless of your socioeconomic status or where you come from, as long as you live, work, and breathe Lagos air, you are entitled to affordable and quality healthcare when you come under the social health insurance scheme being run by government. In terms of what our vision is, we want to be able to achieve universal health coverage, which means that everybody has an access to some benefit package, everybody in Lagos State, regardless. Our mission is to ensure that through health insurance, we deliver affordable and quality healthcare to people, and we are also able to ensure that they are financially protected from, the kind of financial catastrophes when somebody suddenly takes ill in your family and you're now running around to look for money, and families actually do get impoverished from that. So that is something that the agency is frontally addressing. Our core values are an acronym we call TIPI. So there's transparency, there's innovation, there's passion, there's equity, and there's empathy. Those are the things that we stand on in terms of how we deliver our services here.
Thank you very much. Now, health is a major pillar in Governor Babajide Sanwo-Olu's Things Plus agenda. And so as an agency saddled with providing quality health care, what is actually the agency's strategic health master plan? Because you must have a master plan in order for you to achieve your set objectives for Lagosians and the sector in general.
The principles of health insurance, we're looking at ensuring that everybody has access, be it geographical, financial, physical, you have access to affordable healthcare. Affordability in terms of equity, so whether you are a rich man, poor man, beggar man, whatever, as long as you are in Lagos State, you're entitled to the same type of services that someone that is more blessed economically than you has access to. We're also looking to see how we can sustain what we start. So it's not one of the programs that you run into and suddenly it comes crashing down. So that is also something that is embedded into what we're doing to ensure that this is here and it is here to stay.
LASHMA has initiated a robust, all-encompassing health insurance program. So what's the scope of the scheme?
Essentially, the scheme seeks to ensure that people have access to a bevy of primary healthcare services, which a lot of thought and work has gone into that. Scientifically, looking at our disease burden, what are the things people usually go to hospital for. So we have a bouquet of primary healthcare services that everybody has access to. We also have, on top of that, some secondary and some tertiary services. So, for instance, you go into the hospital, normal, we have malaria, have body pain, those kind of things, general consultation, they're covered under the scheme. We go a step further, we can admit you for up to 15 days, and you're entitled to a meal a day. We are very big on maternal and child health, whether it's antenatal, your delivery, be it cesarean or normal delivery, it is covered by the scheme. Postnatal care is also covered. All the childhood illnesses largely are covered under the scheme, and your baby is entitled to care, neonatal care up to 28 days after that baby is born. We handle chronic diseases or hypertension, diabetes. We have a lot of sickle cell warriors on the scheme. We have systemic lupus erythematosus and so on. We do have some surgeries, minor and intermediate. So we do appendectomies, herniorrhaphies. We recently added some eye surgeries like cataract and pterygium. That is also something that we handle under the scheme. We also, of course, give you glasses. We're not talking about the Christian Dior, but something that is functional, and you'll be able to improve your eyesight. We also have dental care, whether it's you want to extract or you want to fill or even you want to do scaling and polishing, it is covered. Laboratory tests, diagnostic tests, all those are covered under the scheme. We recently launched, Mr. Governor launched the standard JARA plan. The scheme has evolved over time in terms of the benefit packages, and we added what we call JARA on top of it. So it's now called the standard JARA plan. And what is this JARA about? You are entitled to cancer care. You're entitled to an annual wellness. You can have your annual wellness checked up, but you have to be on the scheme for up to your second year before you can access that. You also have things to do with dialysis. Of course, there are some terms and conditions attached to all of this. We are the first in Nigeria to integrate telemedicine into the plan. So once you come on board, you are able to either through using our toll-free line or downloading the app for the telemedicine, or even walking into one of our virtual booths, you can access care. So there's quite a lot packaged into the standard JARA plan that is generally that is like our basic minimum plan in Lagos State. We have what we call a seniors plan because we do know that we have quite elderly also need care. So for their plan, there's things like cancer screening, things that affect the elderly more. Their plan is kind of tilted towards their own needs. We have plans for school children. So if you're in primary or secondary, if you're in tertiary, we also have a plan for you. Seniors plan, you can come mommy and daddy. So it's just a couple's plan. We continue to improve on that. We are working towards having something for people that live in the diaspora, for instance. And these are things that will be rolling out in the coming year.
From what you said, it's more like a lot of a combo package. It's so robust. Now, how do you monitor effectively the implementation of these services? Or what do you have any feedback mechanism to ascertain the level of impact this robust scheme is actually offering?
Well, the first thing I'll say is that we're very big on data. So we are entirely ICT enabled from end to end of our entire value chain. We depend on technology. So we're able to have our data at our hand to be able to take decisions as and when to. We have a call center which is 24 hours. We have people that take shifts. So once you call in on our toll-free lines, you have somebody speak to you to walk you through what you need to do. We also have agents spread across all the Ibile divisions of Lagos State and our kiosks, where you can walk in to make inquiries, you can get your plans. In terms of the services that are rendered, we work with both public and private hospitals. In fact, we have more private than public. And they are also on our IT platform. So we're able to see, for instance, the diseases that are being treated. We're able to see the demographics of the people that walk into the facilities. We are able to see how many people have delivered babies, how many malaria cases we have seen, and so on and so forth. We are also able to get feedback from our customers in real time, either when you're in the hospital and you have an issue, you have a chatbot on our website, you can call us through WhatsApp, and so on and so forth. So there are various modalities for you to give us feedback. And that also helps us to ensure that we are providing the service that you require. Some of the feedback that we got, for instance, is what helped us to expand the package to say, these are some of the things that we see people now need and have been ill, and these are things that we should add on to the plan. So we are constantly examining what we are doing and ensuring that we are proactive and trying to meet the mandates that has been given to us.
Okay, so PS, can you tell us what are the toll-free lines and the very reliable social media platforms people can easily get across,
Thank you. So we have 2 toll-free lines that, as I said, we have people behind those lines 24 hours of every day. The first one is the 0800 Ilera Eco, which is 0800 453 72356. The second number is 0800 Ask LASHMA, which is 0800 27 55 27462. We are very vibrant on social media. We are on Twitter, Instagram, Facebook, TikTok. We are also on YouTube, Ilera Eco TV. Our website is www.lashma.com.
That brings me to the issue of collaboration and synergy with both local and international organizations, and of course, non-governmental organizations as well. So what is the nature of the collaboration and synergy with these stakeholders, and to what extent has it actually impacted on your success?
We're very big on private sector participation and intersectoral collaboration. So, for instance, in government, we are working very closely with agencies such as WAPA, who is also in the social protection arm, having some of our vulnerables trained on skills to help them to now start earning money, and then we don't need to pay for them anymore moving forward. We are working with LASRA, for instance. So we are able to pull your LASRA ID when you come and register with us, and they are also able to help us with registering. So that is a partnership in progress. We also can use the LASRA card when you walk into the facility to use that as an identity card for you to access your care. We're also working with LASODA, so we do care for the people living with disabilities. Many of them are also under the scheme and so on. In terms of the international community, we have partners such as Farm Access Foundation. We had very good partnership with USAID until recently when that was made defunct. We're also working with Global Fund. There are quite a lot of partners within that space that we do work with that have helped us in various ways to augment and amplify what we do. So it is something that it is one of our principles here. You must leverage on partnerships to help you. It's scale. You can't do it yourself. You need to leverage on what exists to move yourself forward.
All right, thank you very much. Well, in case you just joined us, we've been speaking with the Permanent Secretary of the Lagos State Health Management Agency, LASHMA. P.S., to what extent can we say, because Lagos is a cosmopolitan city with a population wave growing every day, and there's always the issue of pressure on the health infrastructure. How is LASHMA coping? Is there any effective proactive measures to withstand the pressure?
Well, the first thing was that we were very intentional about not just working with public facilities. We want to work with private facilities so that we can diversify and ensure that we have about 3,000 facilities in Lagos State. Try and get as many of them on board so that we are not stretched in terms of the choices that people have to go and access care. So that's one way that we are helping the health infrastructure. The way health insurance is structured is that money follows the patient to the facility. So the more enrollees you have, the more money comes into your facility. It is like a predictable financing for you. And so once you are on the scheme, you are able to pay your workers' salaries. It is something that's come hell or high water, whether that patient walks in or not, the agency will pay you an amount for that customer every month. So it's predictable financing, and that helps. We've seen a lot of our hospitals develop, even improve on their quality and their infrastructure going forward, simply because their enrollee base is growing. So that's one way that we also help. We've also helped because we know that we have the JAPA syndrome, that human resources is a challenge, not just in Lagos. And that is one of the major reasons why we ventured into telemedicine. So telemedicine helps to take off the pressure on the hospitals. You can sit in the comfort of your home or your office and make a call and speak to a doctor online, who will now walk you through whatever you need to do. And you can now take your prescription and have that filled at a pharmacy. So we are not having so many people walking into the hospital for things that could be sorted out via telemedicine. And that is an experiment that we've seen that has helped as well.
Quality health care actually requires adequate funding. So how well and how far has the Governor Babajide Sanwo-Olu government provided the required funds to sustain the LASHMA project?
I would describe Mr. Babajide Sanwo-Olu, our dear governor, as Mr. Talk and Do. He says he's going to do it, he does it. Since he started the administration, he has shown commitment to this advancement of universal health coverage. We started off by him supporting bringing on board our public servants. So the premium that public servants pays, the government pays 75% of that premium, and then 25% is deducted from the salaries of public servants. That money has continued to be paid by Mr. Governor from the minute we started this in July of 2020 until this very moment as I speak. So our public servants and their families on the scheme, he's in short, let's say he's sponsoring us because he's paying 75%. We're about a population of about 330,000 and counting. That is if you look at the public servants plus their families. And that is something that he has committed to and still continues to. On the part of when it comes to how do we care for the vulnerables, because of course there are people in Lagos that cannot pay for themselves. Not only has he made the 1% consolidated revenue fund a first line charge, which means that that is the first of its kind by any governor in Nigeria. The money comes out in clockwork. He has also expanded the amount from 1 billion, which we got last year, to 3 billion this year, which enables us to be able to cover a lot more people. He gave us approval to be able to cover pensioners. That is pensioners that have come out from even before he became governor. And we have a total of about 30,000 or 30-something thousand of them. He gave us approval to be able to cover those pensioners for free for a year. He also went ahead when we had all these economic issues to start the palliative program, which is a program for mothers where they are able to have their deliveries and cesarean sections provided for by government. That is also something that is being funded through the agency. Not only that, with his approval, we also established what we call the Domestic and Sexual Violence Fund, which is a fund that is set aside and managed by LASHMA for all our domestic and sexual violence victims in Lagos State. He also gave an approval for us to increase the premium for our providers, saying that because of the economy and we know that they also there's a cost of care for them as well, that we should step up the amount that is being paid to providers. And that was done from, I believe, August or September of last year. That has been rolling with clockwork.
Now, let's look at challenges, because despite all these good stories, achievements and success stories, there are possible challenges LASHMA is still facing. What are these challenges, and how or what effort are you making to mitigate against them?
The first challenge I would mention is to do with the fact that people do not understand the concept of insurance. They feel that it is like when they ask you to go and write your will, maybe you are willing death. So buying insurance is also like willing ill health to your family. It's a cultural thing, and it is something that, it's a behavioral sort of mindset, and it needs to be changed. That is one of the hardest things to do, and it is a journey. From where we started in 2020 to now, awareness has grown We have had seen quite a few converts, and we continue to see converts as we go along. So it's something that the agency has been very intentional, knowing that creating public awareness, sensitizing people to understand the importance and the benefits of health insurance is a medium to long-term investment. It is something that you have to keep at it, and as you keep at it, and people come in and they're able to propagate this story to others, it would eventually create a wave, and a change in terms of our behavior. The other one I'll talk about is, of course, people tend to look at things from government with a little bit of a side eye. But we have been very intentional in building the brand of Ilera Eco to show that it is something that is trusted, it is something that is here for you. Another one would be people's ability to pay. So the economy has not been friendly. Affordability is relative. So even though a premium for a year for the entire package is 15,000, some people will tell you, why is it not 5,000? It is a challenge for some people in terms of affordability. Then we also have a challenge with the informal sector, who are people that earn their money on the daily. That's why we have introduced like the flexible payments. You can pay monthly, quarterly, half yearly as you go. So it's like you pay, but you must continue that payment for you to continue to get access to care.
Now, PS, to sustain your goals and aspirations, the agency will require adequately trained, proficient workforce. So let's look at your human capacity program for your team. To what extent are they living up to international best practices?
I would say that LASHMA has a bit of luck in the fact that it does have the ability to be able to employ those that are required. As we all know, health insurance is not really in mainstream public service, and it is a very highly technical field, so to speak. So we have a blend of public servants and people that have been engaged to come and serve the purpose in here. So in terms of we headhunt, we ensure that we get the best of the best in here. We make bold to say that our own retinue of staff can compete favorably with any private HMO in Lagos State. I can extend it to Ghana. We were recently in Indonesia, and we could see that Lagos State is on the right track. Totally.
The health sector in Lagos, we can say, has witnessed a revolutionary transformation through this agency under your able leadership as the permanent secretary. So what would you count as your legacies as this administration winds down?
I would first of all, want to appreciate Mr. Governor for having the trust to bring me here to lead the charge for universal health coverage in Lagos State, because it's a pioneer initiative. So I would say that my legacies are relatively legion, actually, in terms of we've been able to grow the portfolio. We're now at 1,333,000,000 people and counting. We've been able to evolve our standard plan from where it was when we started to the standard JARA, introduce telemedicine, which is something that is the first of its kind. You'll recall that we also had the EcoTelemed during COVID, which was the first state-owned telemedicine platform where we provided care for non-COVID illnesses. We have been able to introduce like a drug access expansion program, so that you don't only have to get your drugs in the hospital. For instance, if the hospital for some misfortune doesn't have your drugs, you are able to walk into a participating community pharmacy and pick up your drug free of charge. That is also an innovation that hasn't been done anywhere, and it's one of our babies that we're proud of. We've also brought on board, apart from launching the standard JARA last year, we've been able to bring on board virtual booths, which is the first of its kind also. And the virtual booths serve as a stopgap for people in the informal sector. When we got to the marketplaces, what we were told was that we can't leave our store. If we leave this store, we'll not make money and we'll go and sit in the hospital the whole day. We like this thing, well, how can you bring it to us? And so the virtual booth was born. It sits in the market. There's a health worker in there. You can go in there, have your blood checks and things done, and you'll be able to consult with telemedicine. doctor, get your drugs, and go back to your store. So it's not everything that you have to go to the hospital except you are referred. So that's one of the initiatives that we are very proud of. We started the Tiwa Cooperative, which is a cooperative that is largely for the informal sector. Because what we realized was when we were doing the pay small, small, it was an initiative we started, there was attrition. People would pay once they get the service they want, they won't come back and pay. And they won't complete their payments. So we started the cooperative whereby once you join that cooperative, they pay us upfront. So we are sitting pretty and we are able to continue giving your care. There are added values. You have access to loans. You can get farm produce at a cheaper price. They do some free tickets and things like that. It's a whole package of value add for the informal sector, and that portfolio is growing. We started the Ilera Eco Academy, where we train people on how to market social health insurance, because it is not a skill, it is new, and we have learned on the job, so to speak. So who better to impart if we want to expand our agent portfolio and get as many people in as possible. So we use that portfolio, the platform, to train other people. We've trained about 588 people so far, and we'll continue to grow that number as we go along.
You've done so much, and I know you still have so much to offer. So in terms of broadening the horizon of healthcare infrastructure delivery in Lagos, what are the new ideas? What are the progressive future plans?
Well, one of the things I'd say is that I believe that health insurance can help to change the landscape of primary healthcare in Lagos State. It can be a veritable vehicle to revitalize the primary healthcare system, and it is something that we are working on very intensely with the permanent secretaries that superintend the health districts across the state to see how this initiative can help in providing predictable financing, and that PHCs can, compete even with the private sector. So another initiative I'll talk about that I think that, is something that is in the offing is to how to successfully blend public and private health provision in a way that there isn't too much of a dichotomy or too much of a difference in terms of what you get in the public and what you get in the private, because health insurance provides a level playing field for you, regardless of whether you're public or private. And because there are quality standards or what everybody's supposed to keep to, it helps to standardize and make it not much differentiation.
Let's look at the process or steps of registration. What does it entail, really?
We have various modalities of registry. You can walk into one of our kiosks. You can make the phone call our line. You can go on our website and self-register. You can use a USSD code. What are we going to ask you when you want to register? We just want to know your name, a little bit of your biodata. Tell us who your dependents are. Are you married? And we have the biodata of your wife or your husband. Do you have children? How many children do you have? What are their ages? You upload your picture. Immediately it will give you a registration number, LSHS, and your numbers would follow. And that is unique to you throughout the scheme. It would ask you, of course, you would have to give us your phone number, and that phone number is also a sort of unique ID for you throughout the scheme. So we expect that is the number you continue to use even if you're coming to renew. You can come in as an individual. You can come in as a family of 4, which is a husband or wife and 2 children under the age of 23. That is a family of 4. Or we have single parents with 3 children under the age of 23. Likewise, if it's a family of 6, you can be a couple with 4 children or a single parent with 5 children. And of course, you have the modality to be able to add on additional children or dependents as you go along. Once you've done that, then you select your facility. There is a list of hospitals. We currently have about 656 hospitals and counting. And you pick either public or private. It's your choice entirely. You select your hospital. And once you've done that, you make your payments. We have channels for payment. We do not collect cash. It is a zero cash policy because we don't want issues of fraud. So you use our channels. I would also like to say that people should not transfer into personal accounts.
Have you been dealing with the challenge of fraud
We
cases?
we have had a few. We track you, and yes, you will spill the money. But once it is something that has been done in our name to a large extent, we will try to be as accountable as possible. But we do send these messages out. Don't pay cash. Don't transfer it to accounts. And once you've made your payment through our channels, we have Picteller, we have Pay Arena, we have T-Bills, and so on and so forth. I mentioned POS as well. You can make those payments. And once you've done that, you are now eligible to start accessing care from the 8th of the subsequent month, as long as you make your payments on or before the 25th of the existing month.
Okay, what is obtainable in foreign countries when you talk about universal health coverage and social health insurance? We also see that there's this synergy with insurance companies and the banks. What do we have here?
We have essentially almost similar. We have some banks partnering with us to also sell health insurance. Some of them are partnering with us to have like a bundled product that would be sold. So we have banks like Sterling, GTB is also coming on board, First Bank. We have quite a few of those working with us. We're also working with what they call fintechs. They also help us to propagate the gospel of Oyedepo. The way we are positioned, yes, we do have insurance companies also, but Tangerine, we have quite a few of them that are working with us. So, you can provide it as a bundled product or you can sell it as an add-on. And we continue to expand that portfolio as we grow.
It's been a wonderful time speaking with you. So, on a final note, what's your word of assurance, encouragement, and expectations from all critical stakeholders, partners, sponsors, and of course, your people, Lagosians?
Just to reassure us all that the Ilera Eco program is very well thought out. It is here and it is here to stay. It will only continue to improve. And of course, the vision is that it will rival anything anywhere else in the world. So it has been built in a way that it is a brand on its own that people should trust in. Come on board, get onto the train of the Lyrical. We have testimonials that we even put out on our social media platforms. With just your shikini money, there is services. And that is the beauty of social health insurance. Partners, we appreciate all the support and we continue to be available. As I said, innovation is very key to keep the mission of social health insurance going. So we are always open to partnerships from any, whether it is within government or outside government or international partners, to see how we can all come together and move this train forward. So Lagos residents, please join the Ilera Eco train. It is for you and it would help your family to have a quality life.
Dr. Emanuela Zamba, any final word for Mr. Governor?
Mr. Governor has been the backbone of this agency. He has not only given support verbally, morally, he has done it financially. He has created an enabling environment for LASHMA to have wings and fly. We are actually like the flagship for social health insurance in Nigeria, just because we have a listening and supportive governor, and we appreciate him for the support.
It's been a wonderful time speaking with you. Wish you all the best. Lagosians are looking forward to improved or better services. So far, it's been a game changer. I mean, in the health infrastructure, especially when you talk about universal health coverage and social health insurance. You've done beautifully well.
Mm-hmm.
Thank you very much for speaking with us. LASHMA Lagos is a template other states must take note of and ride on their creative and strategic policy initiatives to deliver quality healthcare for the citizenry. The City of Lagos TV show will continue in a moment. Stay tuned.